those cuts. And of course, I want to thank Corwell for the incredible work that you do, including delivering our new grandchild last week on the west side of the state. But really appreciate what you do and why it's so important. All right, my husband's grandchild. I know, you're all thinking she's way too young. Anyway, today, so the reason that we're here, we want to talk about the seriousness of this moment and the potential for this massive cut to people who get their health care through Medicaid. So today I'm signing an executive directive on Medicaid to support access for health care for our friends, our family, and our neighbors. I appreciate it when many of the speakers said this isn't just about numbers, this is about people. This is about our fellow Michiganders. This is about every single one of us. Statewide, Medicaid covers 2.6 million people. That's over a quarter of our population. In that number includes 1 million children, nearly 170,000 seniors, and 300,000 people with disabilities. Thanks to Medicaid, survivors of breast cancer can afford annual mammograms. More families than ever get dental care or visit their primary care physician. And parents can focus on getting their sick child into the emergency room instead of staying at home and risking their health because they're worried about the bill. In short, Medicaid saves lives. It lowers costs and ensures that we have a health system that can meet all of our needs, no matter where we get our health care from. And that's why we've taken action in Michigan so that more folks can access the health care they need. As a state senator, I worked across the aisle with my predecessor, Governor Snyder, to establish Healthy Michigan, Michigan's Medicaid expansion under the Affordable Care Act that now covers hundreds of thousands of people. Over the last 2 years, I've signed bills that put critical ACA protections into Michigan state law so that we can ensure people with pre-existing conditions can't be charged more. So we can allow kids to stay on their parents' health care until they turn 26 and guarantee essential services in all health plans. Earlier this year, I committed to working across the aisle to reduce the burden of medical debt for nearly 700,000 Michiganders. And there's important work to do to protect Medicaid happening outside of the Capitol, too. Thanks to organizations like Protect My Care Coalition, we're making progress in every part of our state. Right now, Republicans in Washington, D.C. are trying to terminate access to health care by slashing $880 billion from Medicaid so they can deliver a $4 trillion tax cut primarily for the rich. That's what we're talking about. If this goes into effect, the cost of health care will go up for every single American. Here in Michigan, 750,000 people could lose access to health care. The cuts will hit even harder in small towns and rural Michigan, where 37% of residents are covered by Medicaid. Behind each of these big numbers is a person, a family, a neighbor, whose lives are going to be turned upside down if this happens. Now, I hear a lot from them, people who reach out and they're fearful and they're sharing their stories. A graduate student from Kalamazoo relied on Medicaid to afford a life-saving surgery for her 7-year-old daughter who was experiencing delayed hemorrhage after a routine tonsillectomy. A cancer survivor from Waterford used the Healthy Michigan plan to pay for his cancer treatment and his checkups to make sure the cancer doesn't come back. Terminating access to affordable health care will only hurt those who can least afford it. Seniors in nursing homes, veterans, kids, and the disabled will be hit the hardest. It's not just people's health that will be impacted. It's the Michigan economy, too. Michigan hospitals will lose out on $500 million in Medicaid funding annually, threatening thousands of jobs. The equation is simple. Fewer jobs equal weaker economies and a less healthy Michigan. Hospitals in local and rural communities across Michigan will close, which threatens care for everyone, raises prices for everyone, and forces people to drive further for health care, even in emergency situations. Everyone agrees that there's always more that can be found in terms of rooting out waste or fraud. But this is not about that. This is massive, devastating slashes to core government service. This won't make government more efficient. It'll just raise your costs, eliminate local jobs, and put lives in danger. And that's why today I'm taking action to support healthcare access for Michigan families. The executive directive that I'm about to sign will order the Michigan Department of Health and Human Services to review the proposed federal cuts to Medicaid. It also asks them to prepare a report identifying the specific impact the cuts will have on people's health so we can better protect access to care and so that Michiganders know the cost of what they are trying to do in Washington, D.C. Not them, but what their colleagues on the other side of the aisle are trying to do. We're going to send a clear message to anyone trying to trade your health care for someone else's tax cut. Medicaid is not for sale. I'll keep fighting to lower the cost of health care and support access to our critical programs like Medicaid. Because if you're sick in Michigan, that shouldn't mean going broke. Let's make it official, let's sign this directive, and let's all double down on our efforts to make sure that Congress and our Republican legislators in particular hear us loud and clear. This is an important moment. We can't not fight for the people of Michigan. That's what this is all about. Thank you so much.
Yeah.